Dr. Melissa Wood.
Thank you. Good afternoon, everyone. And I'd just like to say that your County Executive Michael's story, that's really the reason I do what I do every day. I mean, tragically losing a brother at age 44 from a preventable disease is really, really sad. And we've learned over the past 2 decades that we can make simple changes day to day and cut our risk of heart disease and heart attack in half. And in the next 40 minutes, 30 to 40 minutes, I'm going to tell you a story. I'm going to tell you about work that I do with 65 women in a community around Boston called Revere. Now, Revere is a low-income, blue-collar neighborhood where there's a lot of crime, there's a lot of poverty, and women and men live very difficult lives. So as you can imagine, correspondingly, there's a lot of obesity, there's a lot of high blood pressure, there's a lot of stress, depression, and anxiety. So I really picked like the toughest place I could possibly find to do my project, which was to reach out to the women in the community and try to improve their overall health. And not only did we start seeing improvements very early on, we saw dramatic improvements in 3 years with weight loss, reduction in waist circumference, decreased blood pressure. Many of the women were able to come off blood pressure and cholesterol medications. And most importantly, we saw that they were getting out, moving, and having fun. And because this type of program was so effective, I decided to try to put this down on paper and wrote the book Smart at Heart, which really talks about the 10 major steps that we took with these women to improve their overall health. And if you ask why we really reached out to women only, I think it's because for many years we didn't recognize that cardiovascular disease is the #1 killer of women. As you can see by my slide, for many years we thought heart disease really only struck men. And that's because we weren't really looking at the subtle symptoms women were having. If you look at this graph, the red dress represents the number of deaths every year in women from cardiovascular disease. And when I talk about cardiovascular disease, I mean heart attacks, strokes, and blood vessel disease. So nearly 500,000 women die a year from this problem, and that's basically 1 woman every minute. And that's more deaths than the next 6 causes of death in women combined. So as you can see, it's a pretty significant problem. The good news is, over the past 2 decades, we've seen a significant reduction in the risk of dying from heart disease in men. That blue line, you can see, starting in about 1985, really started to go down. So that's the overall number of deaths per year in men from cardiovascular disease. Well, does anybody remember what happened in the mid-'80s? What drugs came out onto the market? Anybody know? Lipitor. Well, drugs like Lipitor, statins. So guess what? Men get heart disease, men got statins. Unfortunately, however, nobody realized that women would get heart disease, and so women weren't getting statins, and we really didn't get to see, and weren't getting the other life-saving treatments like stents and angioplasties that men were. So the improvement in the risk of dying from heart disease really lagged behind substantially up until about the year 2003. Now, if we carried these lines out, what you would see is a continued improvement in men. And unfortunately, in the past several years, the risk of dying from heart disease in women has kind of started to increase again because of this epidemic of diabetes and obesity. And we really need to try to address that problem, and that's why we're doing the study that I'm doing. One of the big issues with why women aren't doing as well is that women have different symptoms than do men when they present with heart attacks. This blue line shows you the chance of a man dying with his heart attack in the hospital at the different age ranges. And you can see the red line, which is women. Women have nearly twice the risk at all different ages. And I'm only showing you these sobering statistics, and I promise I won't show any more death, dying, and cardiovascular disease graphs, but this is an important message. This clearly is something that we need to address in Ulster County, in the state of New York, in the Northeast, in the United States, and globally, because over 8.5 million women die a year from cardiovascular disease on this planet. Part of the reason that we really weren't addressing this, in addition to women having different symptoms, was that the government wasn't funding studies to look at heart disease in women, and really only over the past decade did we have studies that in fact looked at women's outcomes with heart disease. Another problem was that women themselves, those of us in the audience, we weren't aware that we could actually have heart disease. And if you ask women, what is the #1 killer of women, only about 30% of women would say heart disease in 1997. And luckily, thanks to things like the American Heart Association's Go Red movement, we've had a pretty significant impact in educating women about their risks. And now almost 60% of women at least identify heart disease as their #1 health threat. Now, you might ask, why have I decided to specifically focus on women? Well, I think most of us recognize that women make a lot of the major decisions in the household. We decide what we eat, when we eat, how we eat, and we really set the example in most cases by getting out and moving and really showing our children, along with hopefully their father, what needs to be done to maintain our health. But also, we know that women, because of the responsibilities of raising their children, caring for their aging parents, trying to balance a home with a work environment, women tend not to take care of themselves. In fact, women with heart attacks present to the emergency room about half an hour to an hour later than do men. And unfortunately, by the time they get in, they may have done damage to their heart muscle so that it's harder actually to treat it aggressively with things like angioplasties and stents. Women also have smaller arteries and smaller hearts. If you take a man and a woman who are the same height and weigh the same amount, a woman's heart will only be about 2/3 the size of a man's. So that makes it a little more tricky for us to diagnose or recognize heart disease when it's present, and to treat heart disease once we've recognized that it's there. As I mentioned, also one of the issues is that women are more likely than men to have unusual symptoms. So jaw pain, neck pain, back pain, and one of the most common symptoms in women is actually fatigue, where a woman will just have a profound sense of being very, very tired. So we really not only need to educate women, but also the doctors and nurses who care for women in practices and in the emergency room about these different types of symptoms that women may have so that they can address the problem immediately when a woman comes in with a heart problem. So these are just some of the symptoms in women. Again, the fatigue, the pain in the neck, the jaw, the back, palpitations and shortness of breath. Men are much more likely when they're having a heart problem to feel pressure like an elephant sitting on their chest. And that is why women oftentimes are not recognized soon enough and suffer heart damage when they're coming in with a heart attack. So that's all the bad news. Now it's time for the good news. This book was written really to help change those numbers, and I'd really like to see an improvement overall in the risk of dying from heart disease in American women. In our study and in the book, we really talk about 10 areas that we want to work on to try to improve overall cardiovascular health, and those are really the bridges in the book. The first is physical health. Now you would think, I'm a cardiologist, I should be writing an entire book about physical health. Well, it's not to say that I couldn't. I mean, I understand blood vessels and platelets and coagulation, but you know what? No one wants to really hear a lot about that. People want to hear about the steps they can take individually to change their own personal health. So I do go into detail in one chapter about the heart, the fact that the heart beats 60 to 80 times a minute. It beats from the moment the heart is formed in your mother's uterus at about 7 weeks until the moment we pass away. So that heart never really gets a break. It's working hard. It's the hardest working muscle in your body. It pumps about 5 liters of blood every minute, and the harder we work out, the harder it works, and the heart is our friend. It really takes good care of us. I also talk about what are ideal blood pressures, what are ideal cholesterols, how much should we weigh, what are the other health maintenance things that we need to do. And really, I try to give the reader the tools so that you can communicate with your doctor about your health and get the answers that you need. Also, I talk about emotional health, and I think that one of the problems with our healthcare system today is that doctors are so strapped for time that you get in there and you address the problem that you came to see the physician for, and there's no discussion of, well, how are things going at home? Are you anxious? Are you sleeping? As we've heard today already from Dr. Pazinski and others, sleep has a profound impact on your overall health. And yet, in many cases, we may not even have a discussion with our physician about our sleep. So I think looking at all of those aspects of our emotional well-being, it's very, very important because it's so tied to our physical well-being. And in our study that I'm going to talk about, we looked at a number of questionnaires in the women and found that these women in Revere were off the charts. But by offering them an approach like this, they were actually able to see improvements in their stress, depression, and anxiety levels over the course of their participation in the study. We talk a lot about stress management as well, because we know that we cannot take stress out of our lives, but we can certainly manage the way we respond to stress. And I think that's very important in our overall approach to our health. Nutrition, and I know you've heard a lot about nutrition this morning, and you'll hear some more this afternoon, but we focus on healthy eating. And again, I totally agree with Mary that we shouldn't talk about diets, we should talk about eating well for the rest of our life. And I will go into a little bit of detail about each of these areas. Other things that I think are relatively novel in the healthcare world that are included in our discussion are relationships. I think all of us recognize how much a bad relationship can sabotage every good health choice that we make. Communication is very important, as is the environment that we live in. Mindfulness, really taking time to nurture ourselves. And finally, modification. How do we pull all of these steps together to really improve our overall health? So first, I mentioned a little bit about physical health. I try to give you an understanding of where your blood pressure should be. We'd like blood pressure to be under 120/80. Now, I will tell you that as doctors, we put people into 3 classes. People at high risk of developing heart disease, those are people with diabetes or known blood vessel disease. At risk, which are people who have blood pressure issues, cholesterol issues, people who smoke, don't eat right, don't exercise enough, have a positive family history of heart disease, and who are very sedentary. Now, if you looked around the United States and said to yourself, how many Americans fall into that category? I think it's the majority. The best group is the group that's at optimal risk. So those are people that have normal blood pressure on no medicine, good cholesterol, so a total cholesterol under 130, body mass index of 25 or less, and I'll talk about how to calculate that in a minute, exercising at least 150 minutes per week, and that can be walking, just anything where you're moving and you get your heart rate up, and eating a well-balanced, low-sodium diet. Guess what percentage of Americans fall into that optimal risk group? 2%. 2%. So 98% of Americans are either at high risk or at risk. So my personal goal is to get that number from 2% to 10%. And we want to do everything we can, and everybody in this room has the power to change 5 to 10 people that you know, and they have the power to change 5 to 10 people. So really by using that type of viral spread of good information, I mean, we all know how quickly bad information spreads. Let's spread some good information and get people to make changes about their health. Health maintenance is something that doctors are good at when it comes to things like pap smears, mammograms. But I think when it comes to the conversation about cardiovascular health, I don't think we as healthcare providers yet are doing an ideal job. I think there are a lot of things that we don't ask. For instance, in the work that I do, we looked at how many of the women in our study had actually had their waist measured. Well, we know that a waist of over 35 inches increases by at least 2 times your risk of diabetes, and diabetes, therefore, increases the risk of other problems. And no one, not one woman in our study, when we looked at their records, had had their waist measured by their physician, nor had they had their body mass index calculated. So I think that's part of what I need to do is not only educate you, but help us educate physicians and nurses so we can do a better job at overall health maintenance. This is a somewhat complex set of spheres, but I think all of you understand this type of situation, which is our overall health isn't only affected by the choices we make. Certainly the choices we make are critical, but those around us, such as our coworkers, the place where we work, our family, our friends, those also affect us. So does our physical environment. Studies have shown that inner city communities, that we call them food deserts, places where you can't get fresh fruits and vegetables. Kids that grow up in places like that almost have a 3-to-1 chance of being diabetic compared to kids who have fresh fruits and vegetables available in their local grocery stores. Access to safe places to exercise. Certainly, if you live in a community that doesn't have safe exercise facilities, you have to find a solution. So this is such a complex system. And finally, on the outside, which is the pink sphere, you look at things like governmental policy, education, taking gym class out of public schools. I mean, that step alone has really, sabotaged many of our young kids. The food and beverage industry, lobbying to keep those sweetened beverages in school, keeping those sweetened beverages on the shelves. This is such a complex situation that it's going to take years for us to try to make the right path to better health. But I think as long as we understand that there are so many factors at play, we can at least try to work to make the right individual choices. Now, I know that this sort of the theme of this symposium today was obesity and what can we do about it. And I think you've heard a lot today about steps that you can take and really some fabulous things just in this lunch session on steps to take. But I really want to show you why I think, from the perspective of a cardiologist, it's such an important issue. So at the bottom, this is body mass index, and that's your weight corrected for your height. So the taller you are, the more you can weigh and have that number at 25. While it's ideal to be at 25, not everyone was programmed to be at 25, and some of us may be at 27 or 29, but the magic number is 30. When our BMI is over 30, and that's really our definition of obesity, you can see that the risk of having heart issues that are serious goes up by 3 times when you hit that BMI of 30. So it's very important when you see your physician or nurse practitioner that you measure that BMI, get that number so you know where you stand. It's very important to know your numbers. And I just put that in there because I want you to see how important it is. And actually by taking the steps and losing weight, even with weight loss as little as 5 to 10 pounds, we can affect our overall health. This is a map showing the prevalence or the existence of obesity. So that's people in these states that have body mass index of over 30. And the light blue is that less than 20% or less than 10% of the people in that community have obesity. The darker blue is less than 20%. And back in 1990, there was very little, it was not as common as in the year 1999. We started to see more dark blue, which was a higher percentage. And in 2008, we saw many states where up to 30 to 40% of the individuals in that state were obese. So you can see that this map from 1990 to 2008 changed dramatically, and that's really showing you how obesity's taken off. Right now, 22% of Americans are obese. Again, BMI of over 30. The number that are overweight or obese is about 45%. But if we don't do something, in 2020, over 40% of the United States will be obese. That's BMI of over 30. So you can see that this is a problem that we really need to attack. And I want to congratulate Dr. Kay and the rest of the organizers for really focusing this year on such an important topic. I'm going to tell you the story of one woman in my research project. And Grace, that's not her real name, but that's what we'll call her. She's a 48-year-old Honduran female who moved to the United States, and she's a participant in our Happy Heart study. She had a problem before pregnancy, before she delivered, where her blood pressure went up. She had diabetes during her pregnancy, and she then subsequently developed high blood pressure. She's also got an elevated BMI of 32, and she's on several medicines for blood pressure and cholesterol. Her husband is obese, as are her 2 daughters, and her husband suffers from high blood pressure and high cholesterol, or suffered from, I should say. She was referred by her doctor to be in our study, which includes a multifaceted approach with life coaching, nursing coaching, a lot of wellness, nutrition, and exercise education, and social support by the other women in the study. With these interventions, which include the things that I mentioned, she was able to get her BMI down to 27. She's on no blood pressure medicines, and her cholesterol is now in a desirable range. But it gets even better than that. Her husband came to one of the sessions where we were talking about the steps that you need to take to improve your heart health, and he subsequently has lost 60 pounds. In fact, at our holiday dinner, he was so proud to come up and show me his driver's license with a picture that was taken 3 years ago, where he weighed 60 pounds more, and he's now started running, and he actually completed his first 10K. The daughters have also lost weight. So this is showing this incredible benefit. Grace influenced Scott, who's her husband, who influenced Glenn, who works with him. Glenn weighed 400 pounds. He's lost about 85 pounds and continues to exercise. Grace and Scott together influenced their daughters, who then influenced their friends. So you can see by taking one person and making positive choices in her life, we are able to utilize this whole concept of the social network and improve almost in a viral fashion overall health. A researcher from Harvard, one of our colleagues, looked at, I'm sure many of you have heard of the Framingham Heart Study, which is that long-term study where they look at many heart factors in a community, Framingham, where people do not move much, and they've been following them since the late 1940s. And Dr. Christakis looked at 12,000 people to look and answer the question of whether or not obesity spreads through social networks. And he found, in fact, it does. They looked over at people from 1971 to 2003, and they found that if an individual is obese, their best friend has about a 60% chance of becoming or being obese, their spouse 37%, their sibling 40%. But it's not just the fact that they're in like the same area, because if they looked at the neighbor, there was no increase in that likelihood. So it really seems to be that there is some type of social behavior. It's almost like it's okay to do something if the people that you love and trust do that same thing, whether it's overeating, smoking, being obese, drinking too much. If those around you do it, then it kind of makes it okay. Well, the good news is that if someone around you makes a healthy choice, like with Grace's case that I showed you, those people around her are more likely to make that healthy choice. And this has been studied scientifically, and we've certainly seen it in our Happy Heart study. Now, when we talked about body mass index, you know, this isn't a calculation that's easy to do in your head, but you just go to the internet, you Google BMI, and there are about 500 different BMI calculators. This is just an example of one. You can plug in your height and weight, and you can either choose kilograms or pounds, and you can either choose inches or meters. And it will calculate for you your BMI and will tell you where you are. So in this case, a BMI of 24 is normal. And you can do this in about 2 seconds. And again, I think it's so important to carry a little card with you that has your numbers. And those numbers should be your BMI, your blood pressure, your cholesterol, and your fasting glucose. Ideally, we'd like that glucose under 100 and that A1C under 6 if possible. One of the things that we did in our study was really try to help understand why the women weren't exercising, because none of them were. And we actually put together a fabulous video. We knew that many of the women lived in neighborhoods that weren't safe, so we put together a video that they could do at home. We gave them an exercise ball, bands, and free weights. But before we had them start this exercise program, every woman got to go through a personal evaluation by a physical therapist, the nutritionist, and our health team. And the physical therapist found that the majority of women couldn't do strenuous exercise at the beginning of the study because they suffered from issues with knee pain, arthritis, shoulder pain, back pain. So we actually created individual exercise programs targeted to each woman based on her neighborhood, what she could do safely outside, based on her own physical issues, and what would really motivate her. And so what we did that really worked for most of the women was we started a walking club. But we also had other options for them, which include Zumba classes, and I'll tell you a little bit more about our Tai Chi and stretch and relax classes in a second. But we know exercise is so important. As you heard from Dr. Pazinski and the others on the team, it really does stimulate hormones in our brain that help us sleep better. Exercise improves our mood, our sense of self-esteem. And we know that exercise regularly, whether or not we're thin or lean, exercise decreases our blood pressure, our cholesterol, and our chance of getting diabetes. Some of the things that we recommend are that, first of all, if you haven't exercised before, that you check with your doctor to make sure that it's safe for you to do exercise, and even see a physical therapist to come up with some suggestions for the type of exercise that you can do. Walking is certainly far and away, as you heard today again, one of the best ways of exercise, to take exercise in and to lose weight. And I strongly recommend that you get a pedometer. There are a number of different pedometers available. In fact, there are apps for iPhones that you can just click onto your waist when you're walking. And we encourage people to walk 10,000 steps a day. And I will tell you that I work in a hospital, there are lots of steps, and guess what? When I'm walking up those steps, I don't ever see anyone. I just see people walking down. And I'm really trying to encourage my coworkers to take those stairs or to at least walk as much as you possibly can. You know, we use a lot of, we drive our cars a lot in the United States, and I think that decreases the amount that we walk. So try to take that public transportation that you have to walk to or walk home from, to try to think of ways to increase your walking. Have a workout buddy. One of the great things about our study was that these women really created a social network of friends and were able to really tap into that strength and exercise together. Having a buddy not only makes it more fun, but it makes you accountable. If you don't show up, you know, for that 7 o'clock visit to the gym or that 7 o'clock walk, someone's gonna be after you and ask you what happened. So I certainly think that's a great way also. And if you want music, come up with some really fun, jazzy music that will motivate you to keep exercising. I also mentioned that we looked at emotional health, and I just want to show that the link between depression and anxiety and stress and heart disease, high blood pressure, and diabetes is very clear scientifically. We didn't really include stress as one of the traditional risk factors for heart disease until about 5 years ago, when a large study that was done around the world called the Inter-Heart Study identified that stress is a very substantial predictor of heart disease, particularly in young women. So I think we know now that stress, depression, and anxiety play a huge part. Depression, in fact, is quite common after a heart attack or after heart surgery. And so we now actually include as part of cardiac rehab that treatment people go to afterwards, programs to help manage depression. Stress, again, common in our lives and we can't get rid of it, but I think what we do is we help us understand and develop techniques for managing stress. And I think it's important to remember the things that make us stressed in our lives are actually things we should be thankful for. We get stressed about our friends, our family, our job. We get stressed about having to be somewhere on time. You know, what are we going to do with our friends this weekend? But usually, many of the things that make us stressed are actually wonderful gifts to have. Now, I live in Boston, and I have to say driving in Boston makes me stressed. And that isn't something I'm thankful for, but it's something that I've learned to handle. I'll put on some nice music. I'll try to really get into a comfortable, you know, meditative mode when I'm driving so that I don't let all of the people honking and you know, making rude hand gestures really get my blood pressure up. So be thankful for the stress in your lives and forget perfection. Don't constantly seek to be perfect. As I said earlier today, better is the enemy of good. When you're doing something well, just keep doing it. Don't try to be perfect. I think many of us stress and fret about perfection. Also, one thing that I would really strongly encourage you to look at, there's a video on YouTube and there's material available. We heard about it earlier today as well, the relaxation response. There's a guy at Mass General, Dr. Herbert Benson, who developed this technique about 30 years ago. And it's sort of a mindfulness meditation you can do at home, you can do it at work, you can do it for 3 minutes, and it's just where you focus on one word and you shut out all the outside influences. And by doing that regularly, you can actually lower your blood pressure and lower your heart rate and really manage acute stress very successfully. And all of the women in our study were taught this technique. Again, it's free, it's available on the internet. The relaxation response, I strongly encourage you to look at it. These are just some pictures of the women in our study doing various types of relaxation. This is actually chair yoga. So we heard today, we talked a little bit about yoga and how yoga helps us become more mindful and then helps us make good health choices. Well, you don't have to be limber and you don't have to look like you know, a thin, svelte model to do yoga. You can sit in a chair and do yoga with the proper instruction, and you can learn how to do it at home. These are actually real women in our study. One of them actually has to wear oxygen, but yet she is able to do this yoga and really reap the benefits of this. This is an example of the woman doing Tai Chi. Tai Chi is a meditative martial art. It's a great way of focusing and centering. It's a great way of developing relaxation. And I've actually done work looking at the benefits of Tai Chi on patients who have heart failure, where the heart muscle did not pump adequately. And we saw significant improvements in the amount of exercise people with heart failure could do. So Tai Chi, it's been done in China for thousands of years, and it really does have profound overall health benefits. It's especially helpful with aging and helping with balance. This is an example of the women doing our stretch and relax class. So these classes are all group classes where the women can work together, see their friends, have fun, and relax. And this is our fabulous health coach, Eliana, who's bilingual. She really helps our Spanish-speaking only patients participate. And right here, again, they're working on their chair yoga. One of the other key components of health is really nutrition. And we all know this, we've heard it. Nutrition is a great way of healing our bodies, eating the right things. And again, I cannot overemphasize enough, this concept of the diet needs to go out the window. It needs to be, what are the right things that we need to eat? And the first thing we did was have every woman in the study meet with our nutritionist and come up with a plan for their family. The women in my study all were in the poverty range, which in Massachusetts means that you're making under about $28,000 a year in your household, and yet we live in one of the most expensive cities in the country. So these women are really up against a rock wall. But this nutritionist is used to working with them, and she's able to help them come up with healthy alternatives to things, say, like macaroni and cheese, that it's still 25 cents a box. She's able to help them come up with choices like the brown rice, the fresh fruits and vegetables. And we really encourage the women in our study to eat a Mediterranean diet and limit completely or as much as they can any processed foods. We've also worked with them on shopping, teaching them how to shop around the perimeter of the grocery store where everything's fresh and to avoid the center of the grocery store. If you just think for a second about the brilliance that goes into marketing in a grocery store, everywhere that you go where you need to buy things for children, they often have beautiful, colorful boxes of unhealthy things right at the eye level. So those kids want to grab those things, or you, in fact, may want to grab the things at eye level. Healthy things like the buckwheat cereal or the flaxseed, those are down below, and you actually have to reach down and get them. So look down, look up, don't look at eye level. That's another hint. It really does make a difference. One of the points that I also wanted to make in our luncheon session, and I didn't have a chance, when we talked about the person that eats the 1,300 calories a day, well, part of the problem with us calculating the calories in the food that we eat is many of us have poor health literacy. Health literacy means how well can we read a label and really understand what that label means. Again, I think unfortunately we are being a little bit sabotaged by the food industry. We were looking the other night at a bottle of like a flavored water, a healthy flavored water. And it says 80 calories at the bottom. But then, you know, my boyfriend, who's way more brilliant than I am, looked at the back and says, look at how many servings are in this bottle, 2.5, right? So it's not 80 calories, you know, guess again. And I think that many of us are duped into looking at that. We're so focused on calories, we look at that 140 calories, not at the times 3.5 or times 4 in that container. So if there's nothing else that you take home from this session, take home what we've taught our women at Happy Heart, which is learn how to read those labels. And if you can stay away from something with the label, that's the best way to go. So as much as you can do the fresh fruits and vegetables, that's better. Again, go through your refrigerator, do a makeover, get rid of everything that you think has either been there too long or isn't really going to do you a favor. Now, these are the recommendations by the American Heart Association, and I strongly encourage them, these for you in your diet, and this is what we talk to our ladies about. That's at least 5 servings of fresh fruits and vegetables per day, trying to eat fish at least twice a week. If you're eating meats, make sure that they're the leaner cuts of meat and that they're prepared in a healthy fashion. Staying away from sugars, white rice, and white bread if at all possible, going with those whole grain products. And one of the things that's really been shown to be quite helpful is eating lots of nuts and legumes, things like garbanzo beans and seeds. They have very beneficial fats and omegas 3 and 6 fatty acids, which are quite good for us. So trying to get those in as a protein substitute, including things like quinoa. Quinoa is a grain that has a lot of protein and actually is quite filling and can be really nutritious and delicious if you prepare it in the right way. Keeping our fat down to 7% saturated, completely eliminating trans fats, and keeping salt under 1.5 grams per day. And I will tell you that the vending machines at work, and we've pulled things out of there just to take a survey and see, if you took 3 foods out of a vending machine, 3 different packaged foods, you would be over 1,500 grams per day. It doesn't take long to get there, but we now know that even if you don't have high blood pressure, if you eat a high sodium diet, you are more likely to develop high blood pressure because your kidneys start to like salt. So these are some suggestions that our nutritionist, dietitian has made, and I know you're going to hear more about healthy choices this afternoon, but really substituting yogurt for cream, olive oil for butter, again, taking your own bags of nuts and vegetables to work with you for snacks instead of buying things from the vending machine. One comment that I will make is also do a little survey of your workplace. I am very lucky. I happen to work in a workplace that's been given an award for a fit-friendly company. We have choices in our cafeteria that are actually labeled red, yellow, or green. Green is healthy, green is minimal saturated fat. Yellow is not as great of a choice, but still you're getting fiber, you're getting some fresh fruits and vegetables. And red is the hamburger and french fries in the line, which we still serve, but it's labeled red so that the person buying it knows that it's not really the healthiest choice. We also offer wellness programs at our workplace, and I think trying to find places where you're working that have these options, or trying to encourage your employer to make these options is also, or make these choices is also really a great idea, because employers get a discount from the insurers if they offer these types of programs. Next, just to talk a little bit about relationships, I think that we all recognize, and I showed you the story about my subject and how she influenced her family. I think we all recognize how strongly relationships can affect us. And when things are going well, it can be the best thing ever, and when they're not, it can really lead us to making poor health choices. So I think trying to put a little bit more emphasis into helping us with the good relationships and actually ending those relationships that are hurting us or making us feel bad about ourselves. And we really did a lot of that with the women in our study. We helped them look at their relationships. One of the women's daughters was quite verbally abusive to her mother, and every time she would call her mom would hang up the phone and eat a loaf of bread. I mean, she told us, she said, I would eat a loaf of bread. And we just helped her understand that that communication needed to cease for a while, and that she would not take that phone call and not eat that loaf of bread. And over the course of time, she learned how to manage that relationship. So I think it's very important that we do that. Also, creating a social network to support you. The women in our study found friends when they didn't have friends, and they found a network of people that they could reach out to. I think that that's very, very important. So really try to work with those in your family and your friends and become that person who makes that healthy choice that then affects all of those around you. It's such a rewarding thing to see friends make choices. And one of my friend's daughters actually recently started an exercise program, and she lost weight and really started feeling good and had so much energy. And she started telling her friends, and within a month, 8 of her friends got onto the same program. So she really had a profound impact, and I'm not even sure that she recognized how much then they would go on and affect other people, and what really significant changes would be made because of her one very, very smart choice. Finally, your environment. I think we all recognize that living in a cluttered, dark space is bad for us. And we're learning more and more about how those brain hormones affect our choices in our lives. So try to open up your space. Make sure that you're not really exposed to dirty, dark, dusty places. We know that air quality is so important, and you're lucky if you live in Ulster County. The air here is fabulous. If you live in Boston, downtown Boston, where there are diesel buses everywhere, it's a little tougher, but at least you can make choices in your own home to keep things organized and clean. We really encourage people to use more natural cleaning products whenever possible and minimize the exposure to toxins. Communication, I think, is extremely important. I think all of us realize how much poor communication can lead to problems. And I think today, too many people text and instant message and email when they should be picking up the phone and actually speaking to someone. And I think we realize the effect of negative communication on our health. In our book, we talk a lot about how to communicate effectively, not only with your friends and family, but with your doctor. I realize as a physician that and I know this from observing others, that when a patient comes into my office, probably about the first half of that visit, we focus a lot on the discussion, and then we move on to the physical exam, et cetera. And I think that the physician, the prime opportunity you have to talk to your doctor about a problem is when you first walk in that door. And the hardest thing is when you've finished seeing your physician and you're about ready to leave, and then you're like, oh my gosh, I forgot to mention one thing. Your physician may not really be open and listening at that point, so it's really important that you bring a list of questions, a list of problems, a list of medications with you, and you put them right out there at the very beginning. You're the consumer, so you have every right to ask those questions and get those questions answered. And if you don't feel that your physician is listening to you, again, you have other choices that you can make. I think it's really important if you're going to be meeting with a doctor or a nurse practitioner to talk about something important like potential surgery or a potential, really concerning diagnosis. It's very important that you bring someone with you to record that conversation, to write things down. Because you'll be surprised. You'll get home and you may not remember a lot of what that physician had to say if you're very anxious and concerned. The mindfulness piece, I think, was really, in addition to sort of the education and the social support, was part of the reason the women in our study did so well. And that's because we gave them access to things that they'd never had access to before, like yoga, Tai Chi, the relaxation response. We know that these types of behaviors really do affect our health and affect the choices that we make. Finally, modification, which is pulling it all together, and where one of my really wise friends says, this is where the rubber hits the road. And this is really where you take everything that you've heard and learned today from all the speakers and all the exhibits, and you go home and you say, how am I going to change my life moving forward? And I think that's the hardest part. You want to take home the things that really will affect you personally and make little changes each day. Again, we heard that whole snowball concept. Little changes over the course of time have a profound impact. Set realistic goals and look for resources and friends within your community who can encourage you to make the right choices. And we always remind our patients that your someday is now. People love to say, someday I'm going to lose weight, or someday I'm going to get this blood pressure under control. Someday I'm going to start exercising. Someday is now. And today is a perfect day to make that choice. It's beautiful outside. There are fabulous speakers here today. The others that I've heard, it's been a really wonderful, encouraging day. And I think this is such an important time to make some changes. So remember, heart disease is the #1 health threat to American men and women. And you have the power to make choices. It's highly preventable by managing blood pressure, by managing cholesterol, exercise, how we manage our stress. By doing those simple things, you can really make a difference. Don't be afraid to ask questions, know your numbers, and recognize symptoms when they occur. These are all the steps to take to prevent this disorder of cardiovascular disease from taking over your life. And this is my daughter, Caitlin, and she and I'll tell you the story. She ran the last 6 miles of the Boston Marathon with me last year. I ran the marathon in honor of my father who had passed away from cardiovascular disease. And I had sort of, in the time after he had died, I stopped exercising, I stopped eating right, and I kind of got in a little bit of a funk. And I just picked myself up by the bootstraps and I said, what would he want me to do? He would want me to get back in the saddle and get myself back in the right direction. And I think the message really is that we all have little setbacks. I mean, life happens. And you need to be realistic and understand that you're not always going to be perfect. And I think, you know, what I heard earlier today, that 80-20, it's what you do 80% of the time that really makes that big difference. Everything in moderation. And I can tell you that when I crossed that finish line that day with my daughter and the beautiful sun in the sky, I was proud of myself for picking myself up and moving forward again. And I think that that's really the best message, is that everyone here in this audience can make one step and move forward and realize that their someday is today. Thank you very much. And I'm happy to take questions if anyone has questions.
Here we go, we have the first question.
My question is, the women in your study, did they experience the same problem with living in neighborhoods where there wasn't access to fruits, and how did you overcome that?
One of the things that's really nice about Massachusetts, like this part of New York, is that we do have a lot of local fruits and vegetables. And while this is a very low-income neighborhood, in the summer and the fall, they have a lot of farmers markets. And in Massachusetts, one of the really positive things that's happened is that the WIC, which is the Women, Infant, and Children program, they've actually included double voucher credit for fresh fruits and vegetables. So women, even women with food stamps, can now take advantage of buying and getting healthier foods for their family. And also the grocery stores there have made a huge effort. Again, this is such a complex system, and that's why I showed all the different spheres. We have to get government involved. We have to get local government, state government, national government, and we have to encourage people to take personal responsibility and make the right choices.
Do we have any other questions?
And if not, I'm happy to take some. Oh, yeah, here's one. Great.
I feel like Phil Donahue.
I just wanted to know how you stop eating at night. I do fine all day. It comes to 7, 9 o'clock, I'm hungry.
Especially when everyone on TV is eating.
Yes.
So the question is really, how do you stop eating at night? And I think you really have to reframe your behavior. I think that it's easier said than done, but by having things in your house that are things that you can eat that are not unhealthy, and then having to get up and get them, and then realizing, you know, if I have this, it's going to fill me up, but do I really need it? I mean, I think taking that step of when you're getting up and moving into the kitchen, trying to stop that behavior when you have that thought and think of something else you can do. You know, Dr. Pazinski talked about that cognitive behavioral process where we have to kind of reshape our thinking. So instead of getting up and going to the refrigerator, find whatever it is that you enjoy doing. If it's knitting, if it's reading, if it's listening to music, get up and do that instead. And you have to do it and fail a few times, but at least if you keep trying, eventually maybe you'll move in the right direction. You know, also engage, as I talked about earlier, one of the most powerful tools we have is our friends and family. So if you find that it's 7:30, 8 o'clock at night, you want to get into that kitchen, talk to one of your neighbors and say, please call me and remind me why you're calling and why I shouldn't be moving into the kitchen. I'm telling you, the power of the people around us is such an underappreciated thing. So try that trick.
I'm going to call you at 8:30 tonight.
All right. Thank you very much.
Do we have any other questions? Thank you so much,
Yeah,
Dr.
sure.
Melissa Wood.
No problem. No.